Hi, welcome to Turnout. I'm Eric Lamar. President James Garfield was striding down a train station platform here in Washington, D.C. the steamy morning of July 2nd, 1881. Jim Garfield, in office for only 4 months, was on his way to the shore to meet the rest of his family. He never made it. Jim Garfield was shot twice by a deranged office seeker. They didn't take the president to the nearest hospital. Instead, they took him back to the White House. Washington had hospitals then, but they were largely places to avoid if you could. And some things just don't change. Well, hopefully we can agree that the one place that Ebola should not spread is in a hospital, especially one that knew that they were dealing with a known case. It's a bit like a firehouse burning down. It's just not supposed to happen since it's our business to do it right. But in Dallas, it happened not once, but twice. There's a fancy word for getting sick in a hospital: nosocomial infection. Think of it as a kind of bargain. You go in with one issue and leave with 2 or possibly more. If you're on a floor with 50 patients, statistically, 2 of them are sick because of their stay in the hospital. The U.S. Centers for Disease Control reports that there are about 1.7 million hospital-acquired infections in our country, with about 99,000 deaths each year. It's not a pretty picture. And the Dallas Ebola healthcare cases prove that hospital infections are commonplace. And we can't even stop them when they are both explicitly known and announced. Hospitals are dangerous places. The good news is there are a few strategies that can help. Don't go to visit someone if you are unwell because you become part of the problem. Be vocal. If you see unsafe practices or dirty equipment, speak up. Ask to talk to an infection control practitioner or a physician. Don't take no for an answer or be brushed off. Ask to see documentation, and if you're still unsatisfied, take it to management. No one should touch the patient without washing their hands, period. Did you know that in some sectors, up to 40% of hospital-based infections are caused by healthcare worker contamination? Pay attention to any medical device that comes into contact with the patient. It must be properly disinfected. And the room must be clean. If it's not, complain. Or bring your own wipes. I would. Any touch surface, bed rails, IV poles, counter surfaces are prime enemies. And the sicker the patient, the more essential it is to have family and friends as eyes and ears. Hospital infection is not well understood, but it is deadly. And healthcare providers and medical equipment are prime disease vectors. Whatever happens with the deadly scourge of Ebola, the take-home lesson for all of us is that hospitals are a great place to get sick, and the best way to stay well is to be vigilant, to ask questions, and to point out shortcomings. After all, it's your life. For Turnout, I'm Eric Lamar.